How do you manage a patient presenting with chest pain?
When a patient presents with chest pain, my first priority is to ensure their immediate safety and stabilize their condition. I would begin by conducting a rapid assessment using the ABCDE approach: airway, breathing, circulation, disability, and exposure. This helps identify any life-threatening issues that require urgent intervention. I would monitor the patient's vital signs, including blood pressure, heart rate, oxygen saturation, and respiratory rate, and administer supplemental oxygen if needed. Next, I would take a focused history to determine the nature of the chest pain, including its onset, duration, intensity, and any associated symptoms such as sweating, nausea, or radiating pain. This helps differentiate between cardiac and non-cardiac causes. If a cardiac event is suspected, would immediately notify the physician and prepare for further interventions, such as administering aspirin, nitroglycerin, or morphine as prescribed, and obtaining an ECG. Throughout the process, I would ensure the patient remains calm and reassured, as anxiety can exacerbate their symptoms. I would also document all findings and interventions meticulously to ensure continuity of care. My goal is to act swiftly, prioritize patient safety, and collaborate effectively with the healthcare team to deliver the best possible outcome.
What are the key steps in diagnosing and treating sepsis?
Sepsis is a medical emergency that requires prompt recognition and intervention. The first step in managing a patient with suspected sepsis is to recognize the signs and symptoms, which may include fever, elevated heart rate, rapid breathing, confusion, and low blood pressure. I would conduct a thorough assessment, including a detailed history and physical examination, to identify potential sources of infection. Once sepsis is suspected, I would initiate the Sepsis 6 protocol, which includes administering high-flow oxygen, taking blood cultures, giving broad-spectrum antibiotics, starting intravenous fluids, monitoring urine output, and checking lactate levels. These steps are crucial to stabilize the patient and prevent further deterioration. I would also collaborate closely with the medical team to ensure timely diagnostic tests, such as blood work, imaging, and cultures, are performed. Monitoring the patient's response to treatment is essential, and I would continuously assess their vital signs, organ function, and overall clinical status. Patient education and emotional support are also important aspects of care. I would explain the condition and treatment plan to the patient and their family, addressing any concerns they may have. By acting quickly, following evidence-based protocols, and maintaining open communication, I aim to provide the highest standard of care for patients with sepsis.
How would you approach a patient with acute shortness of breath?
Acute shortness of breath is a critical symptom that requires immediate attention. My first step would be to assess the patient's airway, breathing, and circulation (ABC) to identify any life-threatening conditions, such as airway obstruction or respiratory failure. I would administer high-flow oxygen if needed and monitor their oxygen saturation levels closely. I would then take a focused history to determine the cause of the shortness of breath, asking about the onset, duration, associated symptoms, e.g., chest pain, cough, or fever, and any relevant medical history, such as asthma, COPD, or heart disease. This helps narrow down potential causes, such as asthma exacerbation, pulmonary embolism, or heart failure. Based on the assessment, I would initiate appropriate interventions, such as administering nebulized bronchodilators for asthma or COPD, or preparing for further diagnostic tests like chest X-rays or blood gas analysis. I would also ensure the patient is in a comfortable position, often sitting upright, to facilitate easier breathing. Throughout the process, I would maintain clear communication with the patient, explaining each step and providing reassurance to alleviate their anxiety. I would also collaborate with the healthcare team to ensure a comprehensive and timely response. My priority is to stabilize the patient, identify the underlying cause, and provide compassionate care to ensure the best possible outcome.
Explaining cannulation skills with experience.
For cannulation is a fundamental part of my daily routine as a nurse, and I have developed a high level of skill and confidence in performing this procedure. In my current role, I routinely insert 4 lines for patients requiring fluids, medications, or blood products, ensuring that the process is as comfortable and efficient as possible. I always begin by explaining the procedure to the patient, addressing any concerns they may have, and obtaining their consent. This helps build trust and reduces anxiety, which is especially important for patients who may be nervous about needles. I follow strict aseptic techniques to minimize the risk of infection, carefully selecting the appropriate vein and using the correct equipment. For patients with difficult veins, I employ strategies such as applying a warm compress, using a smaller gauge cannula, or seeking assistance from a colleague if needed. I also monitor the site regularly for signs of complications, such as infiltration or phlebitis, and take prompt action if any issues arise. In addition to performing cannulation myself, I often assist and mentor other nurses, particularly those who are new or less experienced. I provide guidance on technique, troubleshooting difficult cases, and ensuring patient comfort. This collaborative approach not only improves patient outcomes but also fosters a supportive and learning-focused environment within the team. Overall, my experience with cannulation has taught me the importance of precision, empathy, and teamwork. I take pride in delivering high-quality care and ensuring that patients feel safe and supported throughout the process.
Describe the steps you would take to prepare a patient for an elective surgical procedure.
Preparing a patient for an elective surgical procedure involves a thorough and systematic approach to ensure their safety and readiness for surgery. First, I would review the patient's medical history, including any allergies, chronic conditions, and previous surgeries, to identify potential risks. I would also confirm that all preoperative tests, such as blood work, imaging, and ECG, have been completed and reviewed by the surgical team. Next, I would provide the patient with detailed preoperative instructions, including fasting guidelines, medication adjustments, and hygiene protocols, such as showering with an antiseptic solution. I would also educate the patient about the procedure, what to expect during recovery, and any potential complications, ensuring they have realistic expectations and feel informed. On the day of surgery, I would verify the patient's identity, surgical site, and consent form to prevent errors. I would also assess their vital signs and overall condition to ensure they are fit for surgery. Emotional support is crucial at this stage, so I would address any last-minute concerns and provide reassurance to help alleviate anxiety. Finally, I would coordinate with the surgical team to ensure a smooth handover, providing them with all relevant information about the patient's condition and preparation. My goal is to ensure the patient feels confident, well prepared, and safe as they proceed with their surgery.
How do you manage postoperative complications such as wound infections or DVT?
Managing postoperative complications requires vigilance, prompt action, and adherence to evidence-based protocols. For wound infections, I would first assess the surgical site for signs of infection, such as redness, swelling, warmth, or purulent discharge. I would also monitor the patient's vital signs for fever or elevated white blood cell count, which may indicate an infection. If an infection is suspected, I would notify the surgeon immediately and obtain a wound culture to identify the causative organism. I would then administer prescribed antibiotics and ensure proper wound care, such as cleaning and dressing the wound according to sterile techniques. Patient education is also important, so I would teach the patient and their family about signs of infection and the importance of adhering to the treatment plan. For deep vein thrombosis, DVT, I would assess the patient for symptoms such as leg pain, swelling, or redness, particularly in the calf area. I would also review their risk factors, such as immobility, obesity, or a history of clotting disorders. To prevent DVT, I would encourage early mobilization, use compression stockings, and administer prescribed anticoagulants as ordered. If DVT is suspected, I would promptly notify the physician and arrange for diagnostic tests, such as a Doppler ultrasound. Treatment typically involves anticoagulation therapy, and I would closely monitor the patient for complications, such as pulmonary embolism. Throughout the process, would provide emotional support and educate the patient about the importance of compliance with preventive measures and treatment.
What are the key considerations when obtaining informed consent for surgery?
Obtaining informed consent for surgery is a critical process that ensures the patient fully understands the procedure, its risks, benefits, and alternatives. The first consideration is to provide the patient with clear and comprehensive information about the surgery, including the purpose, expected outcomes, and potential complications. This information must be presented in a way that is easy for the patient to understand, avoiding medical jargon. It is also essential to discuss any alternative treatments or procedures, as well as the risks of not undergoing the surgery. This allows the patient to make an informed decision based on a complete understanding of their options. I would ensure the patient has the opportunity to ask questions and address any concerns they may have. Another key consideration is assessing the patient's capacity to consent. This involves confirming that the patient is mentally competent, not under the influence of medications or substances that could impair their judgment, and free from coercion or pressure. If the patient lacks capacity, I would involve their legal guardian or next of kin in the decision-making process. Finally, I would document the consent process meticulously, including the information provided, the patient's questions and concerns, and their final decision. This documentation serves as a legal record and ensures transparency and accountability. My goal is to empower the patient to make an informed choice while upholding ethical and legal standards.
How would you handle a patient who is deteriorating post-operatively?
Managing a deteriorating post-operative patient requires immediate action, critical thinking, and effective teamwork. My first step would be to conduct a rapid assessment using the ABCDE approach: airway, breathing, circulation, disability, and exposure, to identify any life-threatening issues. I would check the patient's airway for patency, assess their breathing for signs of respiratory distress, and monitor their circulation, including heart rate, blood pressure, and capillary refill. If the patient is unstable, I would call for help immediately, ensuring the surgical team and critical care specialists are notified. I would also initiate emergency interventions, such as administering oxygen, starting 4 fluids, or providing medications to stabilize blood pressure, depending on the patient's condition. Simultaneously, I would review the patient's surgical history, including the type of procedure performed and any intraoperative complications, to identify potential causes of deterioration, such as hemorrhage, infection, or pulmonary embolism. I would also monitor vital signs continuously and document all findings and interventions meticulously to ensure continuity of care. Throughout the process, I would maintain clear communication with the patient and their family, providing reassurance and updates on the situation. My priority is to act swiftly, prioritize patient safety, and collaborate effectively with the healthcare team to stabilize the patient and prevent further complications.
What is your approach to managing anaphylaxis in a clinical setting?
Anaphylaxis is a life-threatening emergency that requires immediate intervention. My first step would be to recognize the signs and symptoms, which may include difficulty breathing, swelling of the face or throat, hives, hypotension, and tachycardia. I would immediately stop any potential triggers, such as medications or 4 fluids, and call for help. I would then administer intramuscular adrenaline, epinephrine, as the first-line treatment, following the prescribed dosage based on the patient's weight. Adrenaline helps reverse the symptoms by constricting blood vessels, relaxing airway muscles, and reducing swelling. I would also ensure the patient is placed in a supine position with their legs elevated to improve blood flow, unless they are experiencing respiratory distress, in which case a sitting position may be more appropriate. Next, I would administer high-flow oxygen and establish for access to deliver fluids and additional medications, such as antihistamines and corticosteroids, as prescribed. I would continuously monitor the patient's vital signs, including oxygen saturation, blood pressure, and heart rate, and be prepared to escalate care if needed, such as initiating CPR or transferring the patient to the intensive care unit. After stabilizing the patient, I would provide education to the patient and their family about anaphylaxis, including how to recognize symptoms and use an adrenaline autoinjector in the future. My goal is to act quickly, follow evidence-based protocols, and ensure the patient receives comprehensive care to prevent recurrence.
Describe how you would manage a patient with a suspected perforated bowel.
A suspected perforated bowel is a surgical emergency that requires prompt recognition and intervention. My first step would be to assess the patient's symptoms, which may include severe abdominal pain, distension, fever, tachycardia, and signs of peritonitis, such as rigidity and rebound tenderness. I would also review the patient's medical history for risk factors, such as recent abdominal surgery, trauma, or conditions like diverticulitis or peptic ulcer disease. I would immediately notify the surgical team and prepare the patient for further diagnostic tests, such as an abdominal X-ray or CT scan, to confirm the diagnosis. In the meantime, I would initiate supportive measures, including placing the patient nil by mouth, administering 4 fluids to maintain hydration, and starting broad-spectrum antibiotics to prevent sepsis. Pain management is also crucial, so I would administer prescribed analgesics while avoiding medications that could mask symptoms, such as opioids, unless directed by the physician. I would continuously monitor the patient's vital signs, including temperature, heart rate, and blood pressure, and watch for signs of deterioration, such as hypotension or altered mental status, which may indicate septic shock. Once the diagnosis is confirmed, I would assist in preparing the patient for emergency surgery, ensuring all preoperative checks, such as consent and blood work, are completed. Post-operatively, I would monitor the patient closely for complications, such as infection or anastomotic leakage, and provide supportive care to aid recovery. Throughout the process, I would maintain clear communication with the patient and their family, explaining the situation and providing reassurance. My priority is to act swiftly, prioritize patient safety, and collaborate effectively with the surgical team to ensure the best possible outcome.
Are you familiar with NICE guidelines for common conditions such as diabetes or hypertension?
Yes, I am familiar with the NICE, National Institute for Health and Care Excellence, guidelines for managing common conditions like diabetes and hypertension. For diabetes, the NICE guidelines emphasize a patient-centered approach, focusing on individualized care plans that include lifestyle modifications, blood glucose monitoring, and medication management. For example, they recommend regular HbA1c testing to monitor long-term glucose control and the use of metformin as the first-line treatment for type 2 diabetes. For hypertension, the NICE guidelines provide clear recommendations on blood pressure targets, lifestyle interventions, and antihypertensive medications. They suggest lifestyle changes such as reducing salt intake, increasing physical activity, and maintaining a healthy weight. Pharmacologically, they recommend starting treatment with ACE inhibitors or calcium channel blockers, depending on the patient's age and ethnicity. I use these guidelines as a framework to ensure my practice is evidence-based and aligned with the latest standards of care. By adhering to NICE guidelines, I can provide high-quality, consistent care that improves patient outcomes and reduces the risk of complications.
How do you stay updated with the latest clinical guidelines and evidence-based practices?
Staying updated with the latest clinical guidelines and evidence-based practices is essential for providing high-quality care. I use a combination of strategies to ensure I remain informed about new developments in healthcare. First, I regularly review reputable sources such as the NICE website, the World Health Organization, WHO, and professional nursing organizations like the Royal College of Nursing, RCN, or the American Nurses Association, ANA. These platforms provide access to the latest guidelines, research, and best practices. I also subscribe to medical journals and newsletters, such as The Lancet and BMJ, which publish peer-reviewed articles and updates on clinical advancements. Attending conferences, webinars, and workshops is another way I stay informed, as these events often feature expert speakers and discussions on emerging trends and evidence-based practices. Additionally, I participate in continuing education programs and online courses to deepen my knowledge and skills. Collaborating with colleagues and engaging in multidisciplinary team meetings also allows me to learn from others' experiences and stay updated on new protocols. By actively seeking out and integrating the latest evidence into my practice, I ensure that my care is current, effective, and aligned with the highest standards of the profession.
A patient is anxious about an upcoming procedure. How would you reassure them?
When a patient is anxious about an upcoming procedure, my first priority is to provide reassurance and build trust. I would start by acknowledging their feelings and validating their concerns, letting them know that it's completely normal to feel anxious before a procedure. I would then take the time to explain the procedure in simple, clear terms, including what they can expect before, during, and after the process. I would also address any specific fears or questions they may have, such as pain management, potential risks, or recovery time. Providing detailed information helps demystify the procedure and reduces uncertainty. Additionally, I would emphasize the steps we take to ensure their safety and comfort, such as monitoring vital signs, administering anesthesia, and having a skilled medical team on hand. To further alleviate their anxiety, I would encourage them to practice relaxation techniques, such as deep breathing or visualization, and offer to involve their family or support system if appropriate. My goal is to create a calm and supportive environment where the patient feels informed, cared for, and confident about the procedure.
How would you handle a situation where a patient refuses a recommended treatment?
If a patient refuses a recommended treatment, I would first respect their autonomy in decision-making rights. I would take the time to understand their reasons for refusal, which may include fear, cultural beliefs, lack of understanding, or personal preferences. By listening empathetically, I can address their concerns and provide additional information to help them make an informed decision. I would explain the benefits of the recommended treatment, as well as the potential risks of not proceeding, in a non-judgmental and compassionate manner. If the patient's refusal is due to a lack of understanding, I would use simple language and visual aids to clarify the treatment's purpose and expected outcomes. If the patient still refuses, I would document their decision thoroughly, including the information provided and their reasons for refusal. I would also inform the healthcare team and explore alternative options that align with the patient's preferences and values. Ultimately, my role is to support the patient's right to make decisions about their care while ensuring they have the information and resources needed to make those decisions confidently.
Describe a time when you had to deliver bad news to a patient or their family. How did you approach it?
I recall a situation where I had to deliver bad news to a patient's family about a terminal diagnosis. I approached the situation with empathy, compassion, and professionalism. First, I ensured that the environment was private and comfortable, allowing the family to process the news without distractions. I began by asking what they already knew about the patient's condition, which helped me gauge their understanding and tailor my communication. I then delivered the news in a clear and straightforward manner, avoiding medical jargon and allowing pauses for the family to absorb the information. Throughout the conversation, I remained attentive to their emotional reactions, offering tissues and a comforting presence. I answered their questions honestly and provided information about next steps, including palliative care options and support services. I also reassured them that the healthcare team would prioritize the patient's comfort and dignity. After the discussion, I followed up with the family to address any additional concerns and connected them with a social worker for further support. My goal was to deliver the news with sensitivity, provide reassurance, and ensure the family felt supported during a difficult time.
How would you handle a disagreement with a colleague regarding patient management?
If I encountered a disagreement with a colleague regarding patient management, my first step would be to approach the situation calmly and professionally. I would listen actively to their perspective, ensuring I fully understand their reasoning and concerns. Open communication is key to resolving conflicts, so I would express my own viewpoint clearly and respectfully, focusing on the shared goal of providing the best possible care for the patient. If we were unable to reach an agreement, I would suggest consulting evidence-based guidelines, hospital protocols, or involving a senior colleague or supervisor for guidance. This ensures that the decision is based on objective criteria and aligns with best practices. Throughout the process, I would maintain a collaborative attitude, prioritizing the patient's well-being over personal differences. By fostering mutual respect and open dialogue, I believe most disagreements can be resolved constructively, ultimately benefiting the patient and the team.
Describe a time when you worked as part of a multidisciplinary team. What was your role and what was the outcome?
I once worked as part of a multidisciplinary team caring for a patient recovering from a stroke. My role as a nurse was to monitor the patient's vital signs, administer medications, and provide daily care, such as assisting with mobility and personal hygiene. I also acted as a liaison between the patient, their family, and the rest of the team, ensuring everyone was informed about the patient's progress and any concerns. The team included physiotherapists, occupational therapists, speech therapists, and a dietitian, each contributing their expertise to the patient's recovery plan. For example, the physiotherapist worked on improving the patient's mobility, while the speech therapist addressed communication difficulties. Regular team meetings allowed us to discuss the patient's progress, adjust the care plan as needed, and set realistic goals. The outcome was highly positive. The patient showed significant improvement in mobility, speech, and overall independence, and was eventually discharged with a comprehensive home care plan. This experience reinforced the importance of teamwork, communication, and a patient-centered approach to achieving successful outcomes.
How do you prioritize tasks when managing multiple patients with urgent needs?
When managing multiple patients with urgent needs, I prioritize tasks based on the urgency and severity of each situation, using a systematic approach such as the ABCDE, airway, breathing, circulation, disability, exposure, framework. This helps me identify and address life-threatening issues first. For example, if one patient is experiencing chest pain and another requires routine medication administration, I would attend to the patient with chest pain immediately, as it could indicate a cardiac emergency. I would also delegate tasks to other team members when appropriate, ensuring that all patients receive timely care. Effective time management is crucial, so I use tools like to-do lists and electronic health records to stay organized and track tasks. I also reassess priorities frequently, as patient conditions can change rapidly. Communication with the healthcare team is essential to ensure everyone is aware of the situation and can provide support as needed. By staying calm, organized, and focused on patient safety, I can manage multiple urgent situations effectively and ensure that all patients receive the care they need.
What experience do you have in managing surgical patients?
I have extensive experience managing surgical patients, both in preoperative and postoperative settings. In the preoperative phase, I prepare patients by conducting thorough assessments, ensuring they understand the procedure, and addressing any concerns they may have. I also verify that all necessary preoperative tests, such as blood work and imaging, are completed and that the patient is physically and emotionally ready for surgery. Post-operatively, I monitor patients closely for complications such as bleeding, infection, or pain. I administer prescribed medications, including analgesics and antibiotics, and provide wound care to promote healing. I also educate patients and their families about post-operative care, including activity restrictions, dietary guidelines, and signs of complications. One example of my experience involves caring for a patient who underwent major abdominal surgery. I monitored their vital signs, managed their pain effectively, and identified early signs of wound infection, which I promptly reported to the surgical team. My proactive approach helped prevent further complications and ensured a smooth recovery.
How do you ensure patient safety in your practice?
Ensuring patient safety is a top priority in my practice, and I achieve this through a combination of vigilance, adherence to protocols, and effective communication. I always follow evidence-based guidelines and hospital policies, such as the WHO Surgical Safety Checklist, to minimize risks during procedures. I double-check medications, dosages, and patient identities before administering any treatment to prevent errors. I also maintain a sterile environment during wound care and other procedures to reduce the risk of infection. Regular monitoring of vital signs and patient conditions allows me to detect any changes early and respond promptly. Communication is another critical aspect of patient safety. I collaborate closely with the healthcare team, ensuring everyone is informed about the patient's condition and care plan. I also educate patients and their families about safety measures, such as fall prevention and medication adherence, to empower them to take an active role in their care.
Describe a time when you went above and beyond for a patient.
I recall a situation where I went above and beyond for an elderly patient who was recovering from hip replacement surgery. The patient lived alone and was anxious about managing their recovery at home. Recognizing their concerns, I took the time to create a detailed discharge plan that included follow-up appointments, medication schedules, and home care instructions. I also coordinated with a social worker to arrange for a home health aide and physical therapy services. Before discharge, I spent extra time teaching the patient and their family how to perform wound care and use mobility aids safely. Additionally, I provided my contact information and encouraged them to reach out with any questions or concerns. A few days after discharge, I followed up with a phone call to check on the patient's progress and address any issues. The patient expressed immense gratitude for the personalized care and support, which made their recovery process much smoother. This experience reinforced my commitment to providing compassionate, patient-centered care that goes beyond the clinical setting.
What do you think are the key differences between working in the NHS and a private clinic?
Working in a private clinic differs from the NHS in several key ways. In private healthcare, there is often a greater emphasis on personalized, patient-centered care, as patients typically have higher expectations for service and comfort. The pace can also be different, with private clinics often offering more flexible scheduling and shorter waiting times for appointments and procedures. Another difference is the level of resources and technology available. Private clinics often invest in state-of-the-art equipment and facilities, which can enhance the quality of care provided. Additionally, private healthcare settings may have a more streamlined administrative process, allowing nurses to focus more on direct patient care rather than bureaucratic tasks. However, private healthcare also requires a strong focus on customer service and patient satisfaction, as patients are often paying out of pocket or through insurance for their care. This means that communication, empathy, and attention to detail are even more critical in a private clinic setting.
How do you ensure high patient satisfaction in a private healthcare setting?
Ensuring high patient satisfaction in a private healthcare setting involves a combination of excellent clinical care, effective communication, and attention to detail. I always prioritize personalized care, taking the time to understand each patient's unique needs, preferences, and concerns. This helps build trust and rapport, making patients feel valued and respected. Clear and compassionate communication is also essential. I ensure that patients are fully informed about their treatment options, procedures, and expected outcomes, addressing any questions or concerns they may have. I also follow up with patients after their appointments or procedures to check on their progress and provide additional support if needed. Attention to detail is another critical factor. I ensure that the clinical environment is clean, comfortable, and welcoming and that all aspects of the patient's experience, from scheduling to discharge, are seamless and efficient. By combining clinical excellence with exceptional service, I aim to exceed patient expectations and ensure their satisfaction.
What challenges do you anticipate in private healthcare, and how would you address them?
One challenge I anticipate in private healthcare is managing high patient expectations. Patients in private clinics often expect personalized, prompt, and high-quality care, which can be demanding. To address this, I would focus on clear communication, setting realistic expectations, and delivering consistent, high-standard care. By keeping patients informed and involved in their care plans, I can help manage their expectations and build trust. Another challenge is maintaining a balance between efficiency and personalized care. Private clinics often operate on tight schedules, but it's essential not to compromise the quality of patient interactions. I would prioritize effective time management, ensuring that each patient receives the attention they need without unnecessary delays. Finally, staying updated with the latest advancements in healthcare technology and practices is crucial in a private setting, where patients often seek cutting-edge treatments. I would commit to continuous professional development, attending training sessions and workshops to stay current with industry trends and innovations.
How do you tailor your communication style to meet the expectations of private patients?
Tailoring my communication style to meet the expectations of private patients involves a combination of professionalism, empathy, and clarity. Private patients often expect a high level of personalized attention, so I make it a priority to listen actively and address their concerns thoroughly. I use clear, simple language to explain medical terms and procedures, ensuring they fully understand their condition and treatment options. I also adapt my communication style based on the patient's preferences and needs. For example, some patients may prefer detailed explanations, while others may want concise information. I always remain patient and approachable, encouraging questions and providing reassurance to alleviate any anxiety. Additionally, I maintain a respectful and courteous tone, recognizing that private patients often value a more formal and polished interaction. By combining clinical expertise with compassionate communication, I aim to build trust and ensure that patients feel valued and well-informed throughout their care journey.
How would you handle a patient who has high expectations for their treatment outcomes?
Handling a patient with high expectations requires clear communication, empathy, and realistic goal setting. I would start by acknowledging their expectations and expressing my commitment to providing the best possible care. I would then explain the treatment process, including potential outcomes, risks, and limitations, in a clear and honest manner. If the patient's expectations are unrealistic, I would gently guide them toward a more realistic understanding of what can be achieved. For example, I might use evidence-based data or examples from similar cases to illustrate typical outcomes. At the same time, I would emphasize the steps we are taking to optimize their results and ensure their safety and comfort. Throughout the process, I would maintain open communication, regularly updating the patient on their progress and addressing any concerns they may have. By setting realistic expectations and providing consistent support, I can help the patient feel confident and satisfied with their care, even if the outcomes differ from their initial expectations.